This program is about infection control. After completing this lesson, you will be able to name 2 modes of transmission of infection related to care delivery. Identify at least 4 situations when hand washing is necessary. Describe the 3 principles of universal precautions, and name 1 product to use for disinfection.
Did you know we live in 2 worlds? There is the world we can see and touch and hear, and there is an invisible world. Anton van Leeuwenhoek, a Dutch scientist and lens maker, was the first human to glimpse the other world inhabitants. On an ordinary day, he peered through one of his best lenses at a drop of water and was amazed to see tiny beings swimming about. History marks the discovery of a new world on that day in 1683, the world of microorganisms so small we don't even know they're around unless they reveal themselves by their actions. Through the years, we have learned useful information about microorganisms, which are sometimes called microbes. We know there are several different classes. They live in us, on us, and around us. Many are essential. We could not make bread, cheese, or alcoholic beverages without them. Bacteria change organic materials in the soil to enriching nitrogen, so our crops grow healthier and our flowers grow lovelier. Microorganisms live all over our body, but different types thrive safely in certain areas, depending on such factors as temperature and acidity. These normal flora serve useful purposes. For example, they help synthesize vitamin K, necessary for blood clotting, convert bile pigments and acids in the intestine, absorb nutrients, and prevent invasion by disease-causing microorganisms. They are harmless in their natural sites, but even the most friendly microbes can be very dangerous if they get into areas where they don't belong. Millions of E. coli bacteria thrive in the intestine, breaking down foods and changing them into substances that the body can absorb. However, if they enter the urinary tract, they can cause infection. Sometimes normal flora cause illness simply because we are weakened by other diseases, or our resistance is lowered and we are more susceptible to infection. For example, the throats of healthy individuals may harbor lifelong Streptococcus bacteria. It is only when influenza strikes, crushing their resistance, that they fall prey to the familiar strep throat. A few of the hundreds of different types of microorganisms can cause serious diseases, intense pain and suffering, sudden and prolonged illness, and even death. They are called pathogens, or more commonly, germs. An infection is a disease that results when these pathogens get inside the body, multiply, and cause illness. The signs and symptoms depend on the type of the invading microbe, the location and severity of the infection. They include fever, nausea and vomiting, diarrhea, pain or tenderness, fatigue, loss of appetite, rash, sores on mucous membranes, local redness, swelling, discharge or drainage, and others. A chain of events is necessary for an infecting agent, called a pathogen, to cause an infectious disease. Each link must be present in order. If we understand the chain of infection, we can implement measures to break the chain in our everyday work. The first link is the pathogen itself. For an infection to develop, there must be a causative agent which is capable of growing and multiplying. There are many different classes of organisms which cause disease in several ways. Protozoa are parasites that live off the nutrients that cells need to thrive. Malaria and amoebic dysentery are examples. Rickettsia are transmitted by insects. Once inside our body, they multiply in blood vessels. Rocky Mountain spotted fever and typhus are examples. Fungi include molds and yeasts and cause such infections as thrush and athlete's foot. Bacteria multiply in the body and usually destroy healthy tissue by releasing poisonous compounds. They cause a multitude of diseases, among them diphtheria, tuberculosis, cholera, gonorrhea, and typhoid fever. They are the primary cause of staph and strep wound infections. Viruses reproduce by entering body cells and changing cell activity to suit their own needs. Viral diseases include polio, influenza, AIDS, measles, mumps, and the common cold. This program will target the most common causes of infectious disease, bacteria, and viruses. The second link is the reservoir. It is the environment where the pathogen can survive. There are 3 types of reservoirs. The human is a reservoir for many pathogens. Most of the time, the reservoir is a person who is infected with a particular disease. The reservoir may also be a carrier, a person who shows no signs of infection but can spread the disease to others. Animals serve as the reservoirs to infestation of worms, parasites, and other pathogens. And non-animal reservoirs are street dust, garden soil, lint from bedding, anywhere the pathogen can survive. The way the germs get out of the reservoir is the mode of escape, or exit route. In the human, this includes the intestinal tract, the respiratory tract, the genitourinary tract, or reproductive tract, open lesions or breaks in the skin, or through blood. Pathogens usually leave the animal reservoir through mechanical means, such as the bite of an insect or a tick. The mode of transmission is the way in which germs spread from one person or place to another. The first mode of transmission is direct contact with the infected person or infectious material. Pathogens are transmitted through actual contact with the infected person or with secretions from the nose and throat, blood, urine, or feces. When an infected person sneezes, the pathogens are transmitted through the air in droplets. Pathogens in blood, saliva, semen, and vaginal fluid are transmitted directly through all forms of intimate sexual contact. The second mode of transmission is indirect contact. Pathogens can be transmitted through contact with soiled dressings, utensils, any object that has been contaminated with secretions from the host. A food handler, infected with a virus, does not wash his hands after using the bathroom and contaminates the salad fixings with fecal material. The salad transmits the pathogens to the person who eats the salad. Careless handling or disposal of needles can result in transmission of pathogens through an accidental needle stick. The third mode of transmission is through vectors such as animals, insects, fleas, and ticks. The next link in the chain is the mode of entry into the body. The modes of entry correspond to the modes of escape. The pathogen may enter through the mouth, breaks in the skin or in the mucous membranes, the respiratory tract, or the genitourinary tract, or the bloodstream. The final link is the susceptible host, the person in whom the pathogen can grow and survive. Just because the pathogen enters the body does not necessarily mean that the person will become sick. A person's ability to resist infection depends on many factors: age, immunity, fatigue, general health, medications, nutrition, alcohol and drug abuse. People are especially at risk if their normal resistance is impaired by an acute or chronic illness, injury, surgery, burns, radiation and chemotherapy, or by stressful procedures and circumstances. High-risk individuals include infants, children, pregnant women, and the elderly. However, once the pathogen does invade the body and begin to multiply, the signs and symptoms of disease will depend on the type and virulence, or deadliness, of the invading organism, as well as the resistance of the host. In other words, the conditions must be right. Let's just review the chain of infection with our patient, Deborah, to see what happens if the conditions are right. Deborah is recovering from breast surgery. She is weak, and her ability to resist infection is low because she has had chemotherapy to prevent the recurrence of her cancer. Her daughter Emily attends daycare. Almost every afternoon, Emily rushes home with a hug and a kiss for Mom. And Deborah gets a daily kiss from Kitty Cat, a stuffed animal who also attends daycare. Viruses and bacteria that cause diarrhea are alive and incubating at daycare centers, where children, more often than not, neglect to wash their hands after using the bathroom. Kitty Cat, the most cuddled toy at daycare, is also thoroughly covered with disease-causing germs. While the children may develop mild diarrhea or none at all, Deborah, already weakened by disease, surgery, and drugs, may become seriously ill. Here is the chain of infection. Link number 1 is the infecting agent, the virus or bacteria that causes diarrhea. Link number 2, the reservoir, is the children at the daycare center who are infected. Link number 3, the mode of escape, is the digestive tract. Link number 4, the mode of transfer, could be either by direct contact with the daughter, who is a carrier, or by indirect contact through kitty cat, who is contaminated with fecal matter. Link number 5, the mode of entry, is through the mouth and digestive tract by kisses. Link number 6 is Deborah, the susceptible host, who is much loved and very vulnerable. The body's natural defenses might prevent illness entirely in someone who is in good health. Your patient, like Deborah, could die. As caregivers, we must remove the links of transmission and break the chain of infection. If we know the events in the infection process, we can provide the ounce of prevention to break that chain, and we will provide protection for ourselves, our families, our patients, and the public. The first rule of war is know your enemy. Let's see if you do. What are pathogens? What are the 6 links in the chain of infection? What are 3 ways infection is transmitted? This program is about infection control, what you can do to prevent and control the spread of infection and disease. The first step is up to you. Unless you are healthy, you cannot take care of and protect the health of others. If you have even mild symptoms of infection, inform your nursing supervisor promptly and get appropriate treatment. If you have been ill or have symptoms of a respiratory or skin infection, you should not work with patients who are at increased risk for infection until a physician says it is safe to do so. In our struggle against the unseen pathogens, the most helpful words to live by are these: cleanliness is next to godliness. Maintaining good hygiene will not prevent all diseases, but it will increase our chances of staying well while we live and work in a world filled with other world villains. You'll feel good, look good, and smell good too. These are good grooming practices. Bathe or shower daily. Use a deodorant. Germs thrive in body oils and perspiration. Brush and floss your teeth regularly. Good oral hygiene removes germs that cause tooth decay and bad breath. Wash your hair frequently. Hair attracts germs, especially when it's oily. Daily hair brushing removes surface dirt and germs. Hair and beard should be neatly groomed. Cover long hair with a net or pin it back out of the way. Wear clean clothes. Change your clothes every day and when soiled. The next step in our battle strategy deals with practices to limit the spread of infection. Our world is contaminated, meaning there are pathogens present everywhere. In healthcare, contaminated also means unclean or dirty. It would be nice if we could just eradicate all pathogens and live in a sterile world, but that is impossible. The next best step is to do what we can to eliminate disease-producing microorganisms, to make everything clean in an aseptic sense. Asepsis is a term that means the absence of pathogens. Aseptic technique means the practices that prevent contact with disease-producing microorganisms. Aseptic, or clean techniques and procedures, kill or retard the growth of germs so they will not spread and cause disease. Wash your hands. Those 3 little words, repeated over and over by our mothers, still herald the most potent form of infection control. Because our hands are constantly in touch with contaminated surfaces, they are the most common means of carrying infection. So it follows that the single most effective way to prevent the spread of infection is hand washing with soap and water. It seems so simple and obvious a safeguard, yet it is so often overlooked. How many times have you seen people use the bathroom and leave without washing their hands? Often they will stop to fix their hair or apply makeup, yet their hands remain contaminated with millions of potential sources of infection as they touch food or rub their eyes. Here is how to wash your hands properly. Remove jewelry. A watch with a stretch band can be moved up your arm. Wet your hands under running water. Lather well with soap and warm water. Liquid soap is best. If you use bar soap, rinse it off before starting. Hold it during the procedure, rinse it when done, and return it to the soap dish. Keep your hands lower than the elbows so dirty water doesn't run up your arms. Scrub the fingers, palms, back of the hands, wrists, and forearms with a friction motion for at least 10 seconds. Wash for a longer period of time if you had had contact with potentially infectious material, such as dressings or stool. Clean under neatly trimmed fingernails with a soft brush, if necessary. If there is no brush available, use friction. Do not wear fake fingernails to work. They are associated with fungal infections. Rinse thoroughly. Hold your hands up so the water will drain from clean to dirty. Use paper towels to blot your hands dry. If you must use cloth towels, have each person use their own towel and wash them frequently. If you are wearing a ring, be sure to dry underneath it. Use paper towels to turn off the faucets. The sink and faucets are considered dirty. Discard the paper towels. Your agency may suggest that you carry your own soap and paper towels with you. Skin that is clean, dry, and intact poses a formidable barrier to infection. Apply lotion to prevent dryness, chapping, and hangnails. When should you wash your hands? After using the toilet, blowing your nose, covering a sneeze, or combing hair. Before eating, drinking, handling, or serving food. Upon return from public places. Before and after each work shift. Before and after every significant patient contact. After any contact with a contaminated object. After handling waste material, secretions, drainage, or blood. Prevention of costly, life-threatening infection is literally in our hands. Aseptic practices extend to your attire and belongings. Someone who travels from one patient to another without observing proper hygiene becomes a link in the chain of infection transmission. Take the necessary measures to protect your uniform. Hold equipment and linens away from your uniform. Do not wear your uniform around your own home or to go shopping. Do not take personal belongings, such as a purse, into the patient's area. The purse can carry germs from patient to patient. If you must take an item in with you, such as the nurse's bag, be sure to set it out of the direct patient care area on a paper barrier. Healthcare providers must also practice universal precautions. Developed in 1987 by the United States Centers for Disease Control, universal precautions is a method of infection control in which all human blood and body fluids are treated as if known to be infected with blood-borne pathogens, which cause hepatitis B, AIDS, and other diseases. These guidelines were written for everyone in a healthcare setting. There are 3 important principles of universal precautions. Consider all patients infectious, capable of spreading a blood-borne disease. Consider all blood, body fluids, and tissue contaminated. Consider all used needles or other sharp instruments contaminated and able to infect you if you get stuck. Let's examine them more closely in terms of actions we must take. Your supervisor will give you specific directions for individual patient care. Consider all patients infectious, capable of spreading an infection. It is impossible to know what organisms anyone is harboring. Do you have a diabetic patient whose open ulcer has a small amount of bloody drainage and the dressing you change each day? How about that elderly gentleman you care for who has leukemia and developed pneumonia? He's been coughing up bloody sputum. You cannot tell by looking at a person if they are harboring blood-borne pathogens. Consider all blood, body fluids, and tissue contaminated. Universal precautions dictate that you wear latex or vinyl gloves when there is any danger of contact with blood or other body fluids, or with materials or substances that contain or are soiled with blood. Properly dispose of all soiled disposables, such as incontinence pads, gloves, gowns, and dressings, in a double plastic bag. This is to prevent leaking through to the outside of the bag. Close the bag securely before placing it in a trash container. Check with a nursing supervisor or local or county health department on trash disposal regulations. Immediately clean up all bodily fluid spills with disinfectant solution, such as a 1 to 10 bleach solution, and wear gloves. Wash your hands after removing gloves. Immediately and thoroughly wash your hands or other skin surfaces after contact with blood or body fluids, or materials contaminated with them. Wear appropriate protective clothing if there is a possibility that blood or other body fluids will splash or spatter, or soil your clothing. Disposable gowns, masks, aprons, or goggles may be necessary, depending on the type of work you do. Resuscitation masks, bags, or other devices are recommended for mouth-to-mouth resuscitation. Your agency may supply each staff member with a disposable resuscitation aid. Patients' wastes, feces, urine, sputum, drainage from suction bags, can be flushed directly into toilets. This includes waste from AIDS and hepatitis patients. Avoid splashes. Consider all used needles or other sharp instruments contaminated and able to infect you if you get stuck. Although you may not give injections, you may care for people like diabetics who use needles and syringes. Do not put caps back on used needles, remove or bend the needles, or handle them carelessly. All sharp objects pose dangerous threats and must be disposed of immediately after use in puncture-proof, hard plastic or metal containers with a tightly secured lid. If you do not have a commercial sharps disposable unit, a coffee can with a lid or a bleach bottle serves well. You may need to educate patients and families and make sure they understand and follow through. Check with a nurse regarding the disposal of the container. We cannot stress enough the importance of proper infection control practices and compliance with agency policies and local regulations. Gloves are a very important part of that protection. Remember to wear disposable gloves when you have contact with any patient's body fluids or secretions. This includes when giving enemas, emptying drainage bottles, cleaning the genital area, handling vomitus, giving mouth care and tracheostomy care, and so forth. Wear gloves to handle soiled items such as linens, clothing, or contaminated dressings. However, you do not have to wear gloves during casual contact with the patient, such as bathing intact skin, transferring, exercising, or visiting with the patient. As a caregiver, you are exposed to unhealthy environments and habits. Patients, their families, and visitors may know little about hygiene or sanitation. Hand washing is rare in some households. Sometimes families know better but can't manage more healthful circumstances. A stroke victim with limited function and mobility may not be able to brush her teeth or bathe as often as she would like to. Cost can be a major factor. Families who barely have enough money for food are not apt to buy cleaning products. While you do your work, you set an example for patients, families, and friends as you practice and enforce proper infection control. Patients and their families will look to you for advice and direction in health matters. Usually, a brief, clear explanation of the reasons for special procedures will gain support for your efforts. Common sense, empathy, and tact are valuable assets as you teach the patient and the family important infection control practices. Anyone who has contact with the patient must wash their hands thoroughly before and after contact and observe whatever other precautions are necessary according to the particular circumstances. Each family member should use his or her own towels, washcloths, toothbrush, comb, razor, drinking glass, and other personal care items. Encourage the patient and family members to use disposable tissues rather than handkerchiefs whenever possible, and to cover the nose and mouth when coughing, sneezing, or blowing the nose. In addition to proper hygiene, we must follow aseptic practices in the home, especially when someone is ill with an infection. There are two techniques that control germs in the environment. One technique is sterilization. This is a process that kills all microorganisms, both pathogenic and non-pathogenic. The nurse may work with sterile supplies when changing a dressing or initiate sterilization procedures for instruments. Small items can be sterilized by boiling them in water for 20 minutes. The second technique is disinfection. Disinfection is the process of destroying pathogens with chemicals. A mixture of 1 part bleach to 10 parts water, made fresh daily, is an inexpensive and effective cleaning agent. Lysol, 70% isopropyl alcohol, and 3% hydrogen peroxide are also effective, depending on the task. And there are many commercial cleaning products available. Follow directions on the label carefully. A clean environment is not only worth the effort in terms of health, your primary concern, it is safer and more comfortable. Your ultimate goal is to have your patient or their family take the responsibility of keeping their homes safe and sanitary. You achieve that goal by demonstrating what needs to be done, explaining how and why. Your plan of care will include specific assignments. Let's begin in the kitchen, talking about clean as it relates to food. The tops of cans collect germs as they stand on shelves. Use a dishcloth to wash the tops, especially the ridge where the can opener will cut an opening for germs to slip right in. Always wash fruits and vegetables before serving them. Clean the refrigerator weekly, washing it with soap and water. Discard spoiled leftovers. Do not use food that smells bad or looks discolored, or after the expiration date on the package. Pans and dishes that are not used regularly may become contaminated by bugs, ants, or even mice. Wash them with soap before you use them. Be sure to report evidence of pests to your supervisor, who will initiate correction of the problem. Cook meat, chicken, fish, and eggs thoroughly to kill bacteria that can cause sickness in humans. Refrigerate foods that will spoil. Cover food that is left standing out. I don't know about yours, but most kitchens seem to pose a never-ending cleanup chore. Get in the habit of rinsing the food off of dirty dishes and washing dishes after meals. Dishes and eating utensils used by your patient can be washed with the family dishes in hot soapy water or in the dishwasher on the hot cycle. Wipe cooking and eating surfaces with soap and water and keep them clear of clutter and ready for preparing and serving food. Wipe spills immediately, lest you become glued to your job. Mop kitchen floors weekly and as needed to maintain sanitary conditions. Put garbage in sturdy plastic bags or wrap it in newspapers, then place it in plastic or metal garbage containers. Take it out of the house daily. Bathrooms need daily attention. The warm, humid environment is a great place for germs to grow. Flush the toilet after use. Wipe the sink and shower or tub after use. Hang towels up to dry. Clean the toilet at least weekly using a disinfectant, brush, and wearing gloves. Mop the bathroom floor at least weekly. The other rooms in the house will need dusting, vacuuming, and general straightening. Start cleaning in the least soiled areas and move to the dirtier areas. You would change the sheets on the bed before you would clean the floor. Dust away from yourself. Use a damp dust cloth and mop to prevent circulating dust and germs in the air. Wear gloves when cleaning bird cages, litter boxes, and aquariums. Wash your hands after contact with pets. Disease-causing germs are common in pets, their waste, and their surroundings. Linens and clothing, including those used by AIDS patients, can be laundered in the family machine, using detergent and the hot cycle. If they are soiled with blood and body secretions, pre-soak in cold water, then wash them separately. You may add 1 cup of bleach to the wash water when laundering linens and white garments. We've discussed many actions that we can take to stop the spread of infectious diseases. It seems like a lot to remember, yet once you understand some basic principles, breaking the chain of infection is a matter of following simple steps to health. The real key is the knowledge base we have covered. With practice, infection control methods will become a natural lifestyle pattern, a pattern that may well save you and those you love and care for unnecessary pain and suffering, and perhaps even life-threatening disease. Let's see if you know a few of the important basic facts we have covered. What is aseptic technique? Can you name some aseptic practices for you and the patient? What are the 3 major principles of universal precautions? When should you wear gloves? What is disinfection? What can you use to disinfect surfaces? In the course of your work, you will undoubtedly care for many patients with infections. For the remainder of this program, we will focus on the care of patients and the application of infection control principles. Your care plan will include more specific details. No matter what the infection, the patient will no doubt be on medications to treat the infection and related symptoms. You may play a role in the success of the therapy. The patient must take drugs exactly as ordered by the physician and according to the directions on the label. To skip a dose, to take it at the wrong time, or to stop taking it before it is all gone, any type of incorrect administration invites decreased effectiveness of the drug, resistant strains of germs, and recurrent infection. The patients are instructed by their physician, nurse, or pharmacist, but may need an occasional reminder. contact your nurse. Because most drugs are excreted through the kidneys, your patient should drink plenty of fluids. You may be assigned to monitor the patient's output. Report and record any signs of allergic reaction to the medication, such as itching, rash, hives, fever, or gastrointestinal disturbances. The physician may order follow-up urine or sputum specimens to evaluate the effectiveness of the drug therapy. Follow directions exactly if you are assigned to collect a specimen. Label the specimen container with the patient's name. Put it into a labeled plastic bag with a seal lock. The 4 hallmarks of a wound infection are redness, swelling, tenderness, and heat. Sometimes clear tissue fluid that weeps from wounds may turn cloudy, or red streaks may appear on the skin. Or you may notice a yellowish liquid called pus or exudate. There may also be fever and increased pain in the area. If any of these symptoms are present, chart your observations and notify your nursing supervisor. Each agency has its own policies and procedures relating to wound care and your role. You may be assigned to change a dry, non-sterile dressing or to apply clean dressing to a wound that is not draining and that involves no ointments or creams. Your nursing supervisor will instruct you on the exact procedure for each patient. These are general procedures and precautions to prevent transmissions of infection when changing a dressing. Wash hands thoroughly before beginning the procedure. Wear gloves if there is any possibility of contact with infectious material, or if you have an open area on your hands. Explain what you will be doing to the patient. Use an apron or clean towel to cover your clothing if drainage is excessive. Remove tape carefully to protect skin from tears. Remove the old dressing by lifting gently at the corners, touching only the top of dressing by the clean corner. Observe the old dressing for any drainage. Handle dressings carefully. Place soiled dressings directly in a plastic or heavy paper bag to be tied or sealed and disposed of in the trash. Wash your hands after disposing of the old dressings. Unwrap new dressing carefully so as not to contaminate it and apply directly to the wound. Limit taping on fragile skin. Wash hands when done with the procedure. Report to the nurse and document any foul odor, bleeding, drainage, pus, or changes in appearance of the wound. Be sure to disinfect any surfaces which may have been contaminated with drainage. There are 2 diseases which have received much attention from healthcare workers: hepatitis B and AIDS. These are blood-borne infectious diseases. Hepatitis. Everyone knows the word, but few people know much about it. The reason for the confusion is that there are several types of hepatitis. Each has its own mode of transmission, level of severity, fatality rate, treatment, and means of prevention. We will discuss only the viral disease hepatitis B, also called HBV. Hepatitis B is a serious infection control concern for healthcare providers. A person can be infected with hepatitis B and have no symptoms at all. Hepatitis B is transmitted when blood products, or body fluids contaminated with the HBV infect the bloodstream of another person. A mother who is infected can transmit HBV to her infant through the placenta before birth or during delivery. Hepatitis B is also spread through sexual contact and sharing of needles by intravenous drug users. Presently, the highest incidence of HBV is among homosexually active males and is due to their sexual practices. Thorough blood screening techniques have greatly decreased the spread of hepatitis B through blood transfusions. Hepatitis B is almost 100% preventable with a vaccine. The vaccine offers lifelong protection, but is effective only before exposure to the virus. If you believe you are at risk, discuss your concerns with your nursing supervisor. Once symptoms of HBV develop, no one can predict the severity of the illness. If you haven't been vaccinated and think you may have been exposed, contact your supervisor immediately. Hepatitis B immune globulin administered within 48 hours of exposure may reduce the risk and severity of the disease if you contract it. AIDS stands for Acquired Immune Deficiency Syndrome. It is caused by the human immunodeficiency virus, HIV, that attacks the immune system, weakening the body's natural defenses. There is as of yet no cure or no vaccine, and once you get the AIDS virus, it stays in the body for life, able to infect others. Usually, the disease progresses in stages, from exposure to the virus, to the incubation period, to chronic illness, and finally, a full-blown case of AIDS. Symptoms may develop as early as 3 months after exposure, or there may be no initial symptoms at all. Individuals may be infected for as long as 5 years before they even know they have it. It can take as long as 17 years to get from contact to diagnosis. Clinical diagnosis often is not made until the end stages, which means infected individuals who may not know they have the disease are capable of infecting others for years. The course of the disease is unique for each person. Persons with AIDS may experience different episodes and degrees of illness and periods of remission. The AIDS virus lives in blood and body fluids, including sweat, tears, saliva, semen, and vaginal fluids, and is most commonly spread by sexual contact with someone who is infected with HIV, by sharing drug needles or syringes with someone who is infected with HIV, from an HIV-infected mother to her baby during pregnancy or childbirth, and rarely through breast milk. Intravenous drug users, homosexual and bisexual males and their sexual partners, prostitutes, and babies born to infected mothers are at greatest risk in this country. AIDS can also be spread by transplanted tissue or organs, or from HIV-infected blood, blood products, or plasma. People who received blood transfusions before 1985 were at risk. However, our blood donor supply is now carefully screened and is considered safe. Fear and misinformation about AIDS are common, often resulting in rejection and isolation of AIDS patients. It is important that people understand the facts. AIDS is not spread by donating blood, through casual contact such as visiting, shaking hands, hugging, sitting next to, working with, or caring for a person with HIV, through doorknobs, tabletops, toilet seats, animals, insects, air, drinking fountains, the food you eat, or the dishes you eat it from. Hepatitis B and AIDS are transmitted to healthcare workers on the job in 3 major ways. Infected blood from needles, scissors, or instruments can enter the body through accidental sticks or cuts. Every year, Americans use over 1 billion sharp objects in their homes when providing health care. Cuts from broken glass, a razor, sharp objects left in contaminated clothing and linens, and improperly disposed of syringes are all possible sources of infection. Infectious materials can enter the body through contact with damaged skin. Damaged skin can range from cuts, rashes, and abrasions to invisible cracks and breaks due to dry skin or hangnails. All provide avenues of entry. Infectious materials splash into the eyes, nose, or mouth and enter the body through the mucous membranes. To protect yourself from getting AIDS or hepatitis B, there are 3 things you can do. In our work, we must follow and teach the universal precautions precisely. Consider all patients infectious. Consider all bodily fluids contaminated. And consider all used needles and other sharp instruments contaminated. Take the necessary precautions. In our personal lives, we should abstain from sex or practice safe sex by being true to one partner and using rubber latex condoms with spermicidal gel or cream. And we must abstain from the use of illegal intravenous drugs and needle sharing. The control of infectious diseases poses a deepening crisis in the United States. The public health system can no longer contain or effectively treat infectious diseases without help. Communicable disease, such as diphtheria, polio, whooping cough, and tetanus, are resurfacing because children are not receiving proper immunizations. 8,000 unprotected children die each day. We exulted in the discovery of a cure for syphilis 2 decades ago. This disease, which should have been completely wiped out, has soared to epidemic proportions and is now at its highest level since the 1940s. Despite mass education and increased risk, many people still are not taking precautions. Science and technology have teamed through the centuries to rid the world of infectious diseases. But the greatest scientific minds cannot combat the indifference and ignorance of the means of infection control, especially among the poor and uneducated. The war of the worlds, pathogens against people, must be fought every day on every front. We can win the war with the weapons presently at hand, but we must enlist more people into our army, to use their weapons, to take necessary precautions, to be responsible, and to practice infection control, for the sake of ourselves, our loved ones, our patients. Only with your help can people prevail.